Good evening, everyone. We always say welcome to Avini Vibes, where the vibes are great, and we're so excited to be here. We're grateful that you're here with us tonight. I want to just share that we welcome you. Your time is valuable, so we'll try to keep this to about 45 minutes. We'll have an opportunity to ask our guests some questions. If you wouldn't mind, just go ahead and mute for the quality of the recording, and then you can raise your hand. But again, we do not make any medical claims. We do not diagnose, and we do not treat any medical issues at all. But we're here to learn and to share. We're here to learn and to educate. So I'm grateful again that you're here with us this evening. Tonight, we're very honored to have a very special lady, Kelli Callahan, all the way from Idaho. You know, I had the opportunity to not meet her in person, but to have our dear Chip Littlejohn. I called upon him for help, and Kelli right away came to the rescue and shared her experience, her knowledge, and her professionalism that she offers in the field. You know, I'm not going to tell her your journey, Kelli. You wrote me. I always ask for a little bio for our speakers, and it was so touching and so beautiful. So, if you don't mind, Kelli, I'd like you to share, a little bit about yourself, about what you've been doing in the field of thermography. You have a company called Thermography Northwest, and you've explored a wide variety of supplements over the years. But we want to hear about you and your story and how you wind up at Avini. And I know we're going to have some good questions. So welcome, Kelli. Thanks for being with us.
Yeah, thank you, Christine. I'm really honored to actually be here. I feel very honored that you asked me to be on Avini Vibes. And so let me just go right into it. So my name is Kelli Callahan, and I was born and raised in northern Idaho, in beautiful Coeur d'Alene, Idaho. Um, let's see, I used to own a fast food restaurant. That's what we did, and it was a very successful fast food restaurant. And during that time, I'm just going to give you the rundown on how I got into thermography. And during that time, our middle daughter started having some pretty severe health issues. And we went from doctor to doctor to doctor looking for answers, and we couldn't find any answers. In fact, she continued to get sicker and sicker. She was getting ready to graduate from high school, and she wanted to go off to college, and I couldn't send her to college because she was too sick. She wanted to be a nurse. And in the meantime, I had met a chiropractor who said, I can help your daughter. And I thought, you're a chiropractor. How are you going to help my daughter? We've been for 50 doctors, it felt like at that time. And I put it in my back pocket. But as she's wanting to go to college and I can't send her, I called the chiropractor and we went to the chiropractor. And I kid you not, it was about 30 days. And through diet, nutrition, chiropractic care, she was 80% better. And I sent her to college. She came back after that year and she said, I don't want to be a nurse. I want to be a chiropractor. And so now she is actually practicing in the clinic that I rent my room from, which is amazing. But anyway, still have the fast food restaurant, but started to learn, obviously, more about health and nutrition. I always thought it was pretty healthy. I mean, we owned a healthy fast food restaurant, if there is such a thing. We owned a Taco Time, and it was a pretty good run. But my mom had a stroke, and a pretty serious stroke. They didn't think she was going to make it through the night, and I started researching what could we have done to prevent this, or to catch it early or something. And I came across thermography. And so that I began to dig deeper and deeper then into more health and nutrition and learning more. My mom lived almost a year and a half. I had her for another year and a half when they didn't think she'd make it through the night. We did a lot of nutritional things with her. But I started to have this crisis of conscience. I would have people that would come through my drive-through, and I'd look down into their cars and I would see McDonald's and Burger King and all these wrappers, and they'd be coming through my drive-through ordering a large diet Pepsi and the most calorie-laden food that I had. And I really was struggling to continue on in my restaurant. So I actually just shut my doors. I didn't want to sell it to anybody. I didn't want to be a part of it anymore. So I just shut the doors. We sold the property. I cared for my mom in that time. Um, and after she passed away, I came back to thermography. because I was just really interested and enthralled by the technology. And I called thermographers from one side of the country to the other to learn about thermography. And that is how I got started in thermography. So I've been doing
What
thermography.
is thermography? So we're
Oh,
just
what is
the chat.
thermography?
What is thermography?
One of my favorite subjects to talk about. So, mostly what I do is breast imaging. So, breast health education, breast imaging, and thermography is an amazing way to monitor breast health. We're looking more at the physiology of the breast, whereas mammograms and ultrasounds are looking at the structure or the anatomy of the breast. And because we're looking at the physiology, we can see the very first changes happening in the breast tissue on average 6 to 8 years before a tumor's large enough for a mammogram or an ultrasound to even see it. So it's very, very preventative, very preventative. So before that issue begins to be a problem, we can catch it with thermography. Lifestyle changes, dietary changes, those types of things, we can get that risk rating down so that it's not a problem in the future. But so with thermography, also I do full body imaging. So I work with athletes. It's very helpful for athletes, say training for some sort of an event, just to monitor if they're having any inflammation in an area or something to that effect where they're not aware of. We can see it because we're looking for heat. We're looking at that physiology. It's been interesting through the whole COVID era, is the best way to say it. What I've been able to see with thermography, people that are in a long haul COVID situation or just can't get well, we can see some really interesting things. We've been able to find some deep vein thrombosis and some things that have been actually very life-saving for people. So that's been a very, very cool thing through the last
What
few.
you wonder why there's not more people doing it, right? I mean, it seems like it's such a you said it's so prevent could be so preventative and save
Yeah,
lives. So maybe it's a new field, maybe it's we just don't know about it. Maybe that's why we're here tonight, so we can
yeah.
share about
Thermography's been around for 20 years. And people just are not aware of it is the problem. It was kind of mainstream. It's FDA approved as an adjunct for breast imaging. And but it got kind of a bad rap because there were thermographers out there who weren't following the rules. I'm very, very strict on how I treat my laboratory or my room as far as temperature goes because we're measuring heat. And so if your room isn't stable, then you're going to get a bad reading. Well, those types of things were happening. People weren't acclimating to the room. You have to sit in my room and cool off for about 15 to 20 minutes before I start the imaging. If you come outside, for instance, on a 90-degree day, or you have a sunburn on your left shoulder, it's going to cause the heat to be off. So people weren't following protocols, which gave thermography a bad name. And that's when doctors began to kind of poo-poo the technology. And so that's what has happened for thermography, unfortunately. So I'm kind of on a mission to teach people and to educate people that this is an amazing technology.
the clients that you see. Do you see a wide variety? People that are in trouble, and then people that are preventative. What's the variety of client that you may see?
Yes, all of the above. So I
Uh,
have women who actually have diagnosis that come to see me. I have had women who have had past diagnosis that are looking for monitoring. I have women who are in the middle of treatments that come to see me. I have women that are they're looking for a non-invasive, no radiation, completely safe technology to monitor their breast health. And I get a variety. Most of the women I see are 40 and up, but I do get some women even in their 20s that maybe they have a family history, they're nervous, or they find something and they don't want to have a mammogram, or the doctor won't order a mammogram for them because they're too young. So I see quite a variety. It's been interesting this past couple of years since I got into Avini. I have two doctors, two chiropractors in the office where my clinic is, and a pediatric nurse practitioner. And the pediatric nurse, and all of them sell Avini. And the pediatric nurse practitioner has sent me several of her kiddos to monitor. We start when they start on the Avini products. I've got one kiddo that was having some pretty severe issues with her lungs, her since she was a baby. And so we did some imaging on her before she started on the Avini products. And this little girl has been using Cell Defender and Plus Fiber for it's been almost a year, I think. And normally she would be in the hospital with respiratory issues 2 or 3 times a year. And since she started, she has not been in the hospital, not one time. And we were able to kind of monitor, look at what we saw, the inflammation in the area of the lungs, and then looking at it now, and we're just not seeing that inflammation. So that's been really cool. And there's been a couple of kiddos with some different issues that I have seen from Dr. Alicia.
That's a wonderful thing. That's so exciting for that little kiddo, like you said. So I have a question regarding so thermography. I've seen a chiropractor use it for, and maybe this I don't know if it's the same thing, where they look at your feet to look at neuropathy. Is that the same thing?
Yes,
Or
it
is
is.
that,
Exactly.
yeah,
Exactly.
okay.
Yeah. So neuropathy is going to have it's going to be associated with blood flow. And where there's more blood flow, there's more heat. Where there's less blood flow, it's cold.
So this is like the dream the MST. We're talking about lots of colors going on here. Our body
Yeah.
shows lots of colors, right?
Yeah. Yes, the
Yeah,
rainbow. Yeah,
yeah,
absolutely. Absolutely.
yeah.
Yeah.
Tell us about how you were introduced to Avini and how you've been using the products in your profession, in your professional walk.
Yeah, it's a great story. So I was in a meeting and my phone rang and I answered my phone. And I thought to myself, the second I picked up that phone, I thought, why did you answer your phone? And so in my mind, I'm thinking, how can I get off the phone and be polite? I don't want to be rude to this person on the other on the other end. And here I hear blah, 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 blah. I have something that might help you. Blah, 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 blah. Can I meet with you? And I really am not listening. I'm just hearing the little bits and pieces. And I said, just to get off the phone and be polite, can you meet me at my office at 10 o'clock on Tuesday? And he said, yes. So I completely forget about it. And I get a knock knock on my door. There's somebody in the lobby for you. I peek my head out the lobby and I see Shu at the end of sitting in the waiting room. And I kind of rolled my eyes. I thought, oh no, what did I get myself into? I forgot all about this. So, so Shu comes back and he's got his packet of stuff and he starts talking about network marketing and my brain shut off. I was like, nope, been there, done that, not doing it. But the hook for me was zeolite. As soon as he said that word, my ears perked up. I knew about zeolites. I had used zeolites. I wanted them to work, but the product I had been using had not worked. And in fact, I mean, I literally had pulled up on my computer to order the zeolite product that I'd used in the past because I wanted to try it again. So it was perfect timing. And so she left me with all of this information and sent me some videos. Um, and I dug in. I watched the videos. I wanted to learn more. What the information he gave me was perfect and exactly what I needed to hear at the moment. And so that night, I think it was, I went on and I ordered the largest pack there was. I thought, I'm just going to try this. I'm going to see if it'll work for me. Maybe it'll work for my clients in my office. So I ordered the largest pack. Shu called me a couple days later and he said, so what do you think? And I said, well, I already ordered. I'm a distributor now. And he says, what? Great. Let's meet. So we met at our community Croc Center. It's a community center. And we're sitting there talking. And mind you, this is the second time I've ever met this man. And we're sitting there talking and he gets Robin on the phone and we're talking and pretty soon we hear this kiddo scream and he perks up and he says, I'll be right back. And he gets up and he walks away. I sat there for 40 minutes and I thought, this man is the rudest man I've ever met in my life. And finally I get up and I start looking for him. Well, he's standing outside with this woman, and there's this little girl running around, and you could tell that she was probably on the spectrum, and she was talking to him. In fact, he had her on the phone with Robin, and that woman left. I'm standing there now kind of going, wow, this is pretty cool. This is a great first training. And that woman left with a bottle of Cell Defender in her hand. And so that was an amazing first training, but that's how I got into Avini, and that was my very first training. And then I think it was about 2 weeks later, and I was in Dallas with Shu, and met Rick and everybody, and it's been an amazing ride since then. But what I have found in thermography or with thermography is, really we're looking at heat, and heat is caused from inflammation or more blood flow, those types of things. And so when I'm looking at an image with the breasts, if we see more blood flow or blood vessels, vascular patterns, those are things that are kind of concerning. But I can see the rest of the body. So I can see up in the neck area or maybe in the face, or, even when I'm just doing breast image during the abdomen, I get a little bit of that, and I can see the inflammation in the body. And the women who would come to see me, and they would start on Cell Defender only, and they'd come back in 3 months or 6 months. I am seeing absolutely remarkable changes. Um, in fact, the first time I saw those changes, I called Chip and I said, "Hey, Chip, can I send you some pictures of some boobs?" And because I was so excited, a before and after picture of what I was seeing, it was dramatic, absolutely dramatic. And that's what I'm seeing. I'd been using supplements already and recommending supplements. And of course, the doctors in the clinic where I'm at, they do functional nutrition, so they recommend supplements as well. But nothing has made the changes that I have seen with Avini Health, period. Absolutely nothing. So Avini Health is what I use exclusively now in my office.
So obviously, patients come in and they see you, and some people may say, help me, and some people may say, I want help, but don't want to be helped, perhaps, or don't want to listen like you didn't. But it was meant to happen for sure to pick up that phone, and something triggered you to listen. And I think that can be the case with many of us. It's something in us, whether it's a crisis that brings us to find what we're looking for or the answer that we're praying for or whatever. But I appreciate that you were willing to listen and take action, right? It's about taking action, and you did. And now I think of all those people that you see. In the course of your career, now you've been using Avini for how long with this the Cell Defender in your
Um,
practice? Would you say?
it'll be 2 years
Oh,
in
two
the
years.
end of September, 1st of October. So just over a year and a half.
That's great. Do you use any of the other products?
Oh yes, yes.
Yes. Can you
So
talk a little bit about that?
yeah, when the Plus Balance came out, when I was at Summit, I about jumped out of my chair because that was everything that I could possibly want in thermography was that Plus Balance. I mean, put that together with the Cell Defender, and wow, we have like a major, powerful 1-2 punch for anything when we're talking about breast health or even inflammation in general. But in the past, I had used the calcium D-glucarate and the DIM products separately, and I had had problems with them. So for myself, when I take DIM, it would give me excruciating headaches. And I had had the same experience with some of my clients as well, getting terrible headaches. So when I first got the product, I was really careful about taking it. I'm like, oh, it's got DIM in it. I got to be really careful. Never had a headache, not once. And I did take it in the beginning at a little bit higher dose. But still, never once did I get a headache. And so it just shows me that Rick's products are remarkable. Period. What we have our hands on are, I mean, there's bar none, nothing better out there. But using that product now, because we also get what's called a hormonal grade with thermography when we're doing breast imaging, and we can see up to 50% more excess estrogen hanging out in the fatty tissue of the breast than you're going to find in serum blood levels because it tends to hang out there. It doesn't metabolize out, and especially if you're not a good detoxer. And so using the cell defender to help get the detox happening, and then using the plus balance on top of it is just, there's nothing more powerful. I can't think of anything more powerful in my practice, period.
When a woman comes in and goes through this process, when would she come back? What's the time frame?
Well, that depends. So I'm not a doctor, I'm a technician. So all of my images go off to a board certified thermologist who reads the images and sends back a report. And depending upon what the risk rating is, so we have a risk rating of low risk, medium risk, or high risk. And so it depends on what that risk rating is, how soon they come back. So it could be 3 months, 6 months, or back in 9 months or a year.
Okay. What about the mushrooms? What's your feeling about the mushrooms? Have you used them personally and
Oh,
have you
yes.
used them with your clients?
Yes, I use
I
them every
love the
day.
mushrooms, yeah.
So let me walk you through. Somebody comes in, a woman comes in and she sits in my chair. I say, you're going to sit here, you're going to acclimate for 20 minutes. And in that 20 minutes, it can be a little uncomfortable for somebody coming in to see me because they're disrobed from the waist up. So I try to get them talking. I talk to them about, what do you do for a living? Do you have children? Or what have you done in the past? I just try to get them talking. And I hear everything. I hear about their health issues. I hear about their kids, their parents, their best friend, their siblings. I hear everything. And so it's such a perfect fit because in the beginning, when I was brand new, I mean, I'm talking days old, I didn't have product in my hands. And somebody would start talking to me, and I'd be like, oh, I might have something that'll help you, but I don't know very much about it yet. And I would pick up that phone, boom, 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 and I would call Robin, I would call Chip, I would call Shu, I would call somebody because I didn't know anything at all. And I would just do a three-way call. And that is how I built my business very rapidly in the beginning. Well, of course, I started to learn more. I still do three-way calls. I do them pretty often still, but just getting, just having that excitement of listening to somebody tell me that they have a parent who's struggling with some kind of an issue, or a child that maybe is on the spectrum, or their best friend just had a terrible diagnosis of some sort. And for me to be able to say, I've got something that I think can help you, that has been, I mean, it just almost brings tears to my eyes because who has this? And if we don't tell them, they're not going to know.
Oh, well, right. Yeah, and you got a good teacher there, Shu, because Shu just gets up every day and marches out the door and doesn't know who he's going to come across, right? But he's bold, his heart is pure, and he just wants to share. That's what I love about this company. You know, it's not about you, it's not about me, it's not about Carol, it's not about Chip, it's about the person that's looking, person that's seeking something to address their health issue or their child's health issue. I met with a gal today. I'm hoping she's on. It'll be a whole nother story. I told her she's going to be a guest. She's brand new, but her story is very, very powerful, like yours. And she said she heard somebody say the other night, "Give him a fighting chance." Right? That's what we have to do. We always hear the 1-2 punch. We got to give him a fighting chance.
Mhm.
So anyway, I would like to open it up for questions, but before I do, is there any other thing that you would like to share with us? I will give you the opportunity to give us your words of wisdom before we let you go, but I'd like to the audience to ask you a question if possible. That's okay with
Yeah,
you.
yes, absolutely.
Yeah. All right. Anybody have a question for Kelly? Carol, I can't see the hands.
Okay, let me see
Maybe,
if we got any hands, and I'll tell you in a second.
and maybe you already answered
Um,
the questions.
I
Gary has
yeah.
one.
Let's see. Hold on.
Gary always has good questions. Go
Gary
ahead,
has.
Gary.
Kelly, I have a question.
Yeah.
So, this is a hypothetical with an athlete. He's a runner, and for example, he has trouble in his with one knee. So, what would if that person came to your office and you used the thermography? What might you see that would indicate that there's some issue, and how might you be able to um, help them on a path to health in a short amount of time by just doing your magic with your technology.
Yeah, that's a really good question because it's really interesting when I have somebody come in like that. When we're doing thermography, we're looking for symmetry. So I'm not going to image just one knee. I'm going to image both knees. And when I have somebody who maybe they have an injury to their right knee, it's interesting because I see the inflammation in their left knee. And
What?
so, yeah, because they are compensating so much and they don't realize it. And so that's oftentimes what I see when I hear of somebody who has that exact type of an issue is they're overcompensating and the other knee is picking up so much of the stress. And so with that information, again, I'm not a doctor. All we're doing is imaging, but he can take that information then to his doctor or physical therapist or whoever, because maybe it's not going to show up on any kind of, structural kind of imaging that the other knee is having a struggle, but it's going to give the PT enough information. Now we need to change this up a little bit because we're really seeing some stress on that other side.
Okay, great. Thanks.
Okay,
Yeah.
we have another question, and that is Hannah.
Kelly, I'm so glad that you're on because, I'm at the stage that number one, I need to get a mammogram, and I really don't want to have a mammogram. And I'd love to do thermography, but I'm also 7 months after having been hit with a car, my whole body, including my head. I just would love to I just have thought that thermography would give me an insight as to I'm having still pain and whatever, and just an idea as to what I'm have what I'm existing with right now and what I need to work with, and including down to my knees,
Hmm.
because my whole body has been trauma, and but here I'm in New England, I'm north of Boston, so it's an interesting area. And I began to look up thermography, and I'm not finding many locations. I think I did find one for breast imaging, but
Yeah.
Thank you, Hannah.
Hannah, are you coming to Vegas?
yeah, yes, I am.
You are? Okay.
Yeah, oh yeah, oh yeah.
I I have a really wonderful friend who's in Vegas who's a thermographer, and I can connect the two of you. If you had the time to take a little bit of extra time, I'm actually already connecting another person with her just for that exact reason. There's nobody in her area. Now, again, there's different thermographers out there, and just because 20 years ago there was bad thermographers doesn't mean that there's still bad thermographers. Trust me, that don't have really good equipment, that aren't following the protocols, all of those things. And so my friend Julie in Vegas, who will be at Summit, by the way, yay, is fantastic, and she has wonderful equipment, and she's very, very experienced. And I would definitely connect you with Julie when you're in Vegas.
So
Definitely.
you
I'm
never know, you
arriving
never know
on
what's going
when
to
there's a
happen.
reason why I'm coming Wednesday then to
Perfect.
be there.
Thank you.
Beautiful.
You never know
Thank
what's going
you.
to happen. Keith, I think, has his
Yes,
hand up.
Vernon
Keith,
Keith Sims,
see you.
go
And
ahead.
we'll have
Thank,
Lisa.
thank you so much. Grateful for your presentation. Unfortunately, I was a little tardy. Um, I have been suffering from neuropathy in my feet, and now kind of they said it was sock neuropathy. It would work its way up, and it has. Started in my left foot, big toe, spread on that foot, and then the right foot picked it up, and it's kind of at the ankles or thereabouts with that weird sensation. Um, I'm not familiar with thermography. Uh, I've been hoping that I was going to create a story around my body relieving the discomfort of neuropathy here. You mentioned neuropathy earlier. Um, 12, 13 years ago, when I was seeing various neurologists about it, they said, well, you don't have diabetes and you don't have the other extreme of you're some kind of hybrid or something. So just contact us when the pain gets too much and we'll give you drugs for it. Um, yeah. I was on duloxetine for a while. I'm not on it right now because of some blood pressure medicine. I'm trying to find my way back. Can you share your knowledge about neuropathy, uh, maybe the how did thermography is that?
Thermography. Yeah.
Thank you. Thermography and the Avini, I think you mentioned the balance product being a kind of a 1-2 punch or something and cell
Yeah.
defense
Yeah.
for people.
Absolutely. How long have you been on the Avini products?
I just got back on Monday.
Okay.
Um, I have Cell Defender, Balance Plus, the cardio, the meal replacement, and I just found out that I think I had the coffee packets that were supposed to help. But yeah, it's kind of shot my heartbeat per minute up to, 100 and 100 and yeah, too much. So I'm going to back off of that and
Okay.
work with the other.
So thermography, what again, I'm not a doctor. So we're
Sure. Yeah.
going, it's going to be imaging that's going to probably show that there's thermography. Sometimes thermography is that last little piece to the puzzle with somebody who has something going on that nobody can figure out.
Hmm.
And so sometimes it can give you a lot of really, really great information that you weren't expecting to find. Other times you might get it back and you might be like, I knew I had neuropathy. Well, we knew that coming in. But I think you're on absolutely the right track moving forward with the Avini products. And my recommendation for you would be a three-way call, probably with somebody like Chip Littlejohn, because he's very, very knowledgeable and is going to be able to give you some great insight and direction.
Hmm.
So,
Thank
and
you. Yeah.
who you know who your upline is, you can get a hold of them, and I would highly recommend a three-way call for you to get exactly what you need.
Thank
Thank
you.
you. We
I
will we will connect you, Keith, too, with
Yeah,
Chip
thank
we
you.
before
will.
this call. After the call, we'll send you Chip's number and Carol can make that arrangement for you.
Yes. Thank you. Thank you
Thank you.
all.
Oh, lots of hands up now. Lisa D,
Lisa.
you're up, and then
Hi.
Tana's next.
Hey, Kelly. Thank you so much for bringing so much awareness to this. I've been aware of thermography for many years. I had one done about 10 years ago. And still to this day, it's interesting that you say you send it to the doctors for reading. Because I've mentioned it to gynecologists and stuff, and they're like, what is it? They really are clueless. And I don't know if it's still today. That's the case on
Oh, yeah, they're still
how they
close.
can.
So when I say I send it to a doctor, he's a board certified thermologist. So he's not your traditional medical doctor. I mean, he's a doctor,
Okay.
but he's specializes in thermography. When I send it off to, for instance, I always say, would you like me to send this to your doctor? They'll give me the information to send it to the doctor. The doctor will usually go, oh, yeah, no, that's no good. You still got to have your mammogram.
Yeah,
So
exactly.
I go through a whole education piece with the women who come to see me because really you're in charge of your healthcare. You get to choose what you're going to do.
Oh, yes.
And I lay, here's the pros and cons of all of the breast imaging. There's no breast imaging that's 100% accurate. None of them are. For
I,
myself, I do thermography every 6 months or every year, 6 months to a year, and I do an ultrasound every 2 to 3 years. So I get that structural test as well. But I do not personally, I do not do mammograms.
yes. I won't do one either. So they're kind of pushing me towards that, and there's nobody around here anymore. So was there a lot of schooling and that you went through for this as a holistic practitioner? I was always interested thinking to do this myself.
Yeah, well, I did my schooling actually through COVID, and it was in the very beginning in 2020, and it took me about, I don't know, 3 months to get through the schooling, but then you had to do
Okay.
imaging after that to get your thing. And I'd love to talk to you, Lisa, after this. And
Absolutely.
yeah, please.
Thank you.
If Christine, if you can share my information with Lisa, that'd be great.
All right.
Absolutely. Thank you,
Appreciate
Lisa, for
you.
the
Yeah.
We will
question.
share this.
Thank you. Tana's next. You have a hand up. You just got to unmute.
There we go. Can you hear me?
Yes.
Yes.
Hi, Kelly.
Hi.
I just want to ask you how you almost got to this answer before, but didn't quite get there. Like, how do you go about finding someone in your area that is a good thermographer?
Yeah. So I have helped people try to find thermography clinics in their areas, and it's really hard actually to try to find somebody that you know is going to be good. What I would do is I would Google it, and then you can call the thermographer, and the questions I would ask would be, what are your pre-imaging protocols? So you want to make sure that they're asking you to do certain things, specific things. Like in the summertime, if it's 100 degrees outside, you can have the air conditioning on in your car, but don't have it blowing directly on you. Try to stay away from caffeine at least 2 hours before you come to see me. Caffeine can dilate the blood vessels. Dilated blood vessels causes more blood flow. More blood flow causes more heat. If you have a sunburn, don't come to see me. We need to reschedule. So there's certain things. Don't go see a chiropractor. No, working out really hard within 24 hours of coming to see me. Don't sit in a sauna. Don't have it. There's a lot of things. So that would be number one. Ask them, what do they have pre-imaging protocols, and what are they?
Okay.
That would be number one thing I would ask. And then making sure that they have a doctor or board certified thermologist reading the scans, that they're not reading the scans themselves. That would be the other thing.
Okay. I'm down on the Gulf Coast, so
All right. That was a great question.
Oh, there's lots down there.
really,
See.
like in North Florida. So I don't know, maybe down in the Destin area, or there may be more options down there because there's wealthy people down there and they have a tendency to have other things to choose from,
Call me. We'll figure it out. I'll help you.
Okay. Thank you so much. I really
You're
appreciate
welcome.
Been wanting to ask you this forever. So
Yeah,
I-
I'm happy to help.
oh, and I wanted to tell Vernon, with Trim Science, sometimes I'm very sensitive to it too, but if I can take a little bit, but I'd have to take it in something that has the fiber in it. If you take it with the fiber, it processes slower in your body, and you don't get some of the spikes that you get if you just take it straight up. Or that's been my experience.
Thank you so much.
You're welcome. And Chip might can address that. I don't know.
Thank you.
Welcome. Thank you, Kelly.
Well, speaking of Chip, I don't see him on the screen, but I'd like
Yeah,
to
he's here.
bring,
He's here.
bring Chip on, and then we'll have you close us out, Kelly, after we have an opportunity to hear from Chip. All right, and then Kelly will give us some words of wisdom.
Okay, well, hi, can you hear me okay, Christine?
Yes.
Yes.
Okay.
Can't see you, but I can.
Oh, you
Carol's
can't?
screen.
I'm
No,
here
I
somewhere.
see Kelly. I just see Kelly.
Chip, can you raise your physical hand so I can actually add you in the spotlight?
Okay, let's see here.
I'm not being able to see you, and that's why. Oh, there you are. Okay, I will add you in. Hold on.
Thank you, Carol.
There you go.
There he is.
I'm sorry, I was a couple of minutes after you guys were giving disclaimers and so forth before I arrived this evening. But and fun to see Kelly here and to hear her in this role. Most of the time that I've been around Kelly, she's been like really, really quiet. I met her at Dallas. She and Jody came with Shu that time, and I thought, oh, okay, here we go, because Shu had been out, looking for a running buddy, somebody to do this with, somebody fun and influential and I think credible to do it with. And all of a sudden, here he shows up with a pretty girl on each arm, and they're both smart. And here we are in Dallas, and they're both like days old. And then Carrie and Kelly tonight step to the front and take the microphone, take the stage, take the audience with absolute confidence. That's for this to grow, you don't have to be absolutely confident yet. You can be like she was, excited. And you heard her say, I was looking, I thought I'd already tried zeolite. That leads to my comment that the people who are claiming to have imitated this and have not, it is a cruel and inhumane misrepresentation. We all get it from the same mine, and it comes all in the same brown paper bag. It costs $900 a ton to get the raw material. You can put that in a product and pretend that you've got the real thing, and it's nothing, really. But after it goes through Rick's hand, it goes through our laboratory in Boca Raton, then you have Avini detoxylite. Then all this magic starts to take. It's not that nothing happens with the raw material. The very first study that Rick ever saw was dogs that had the raw material put intravenously into their bloodstream, and their tumors began to reduce. Well, why did that happen? It was dirty zeolite. Well, why does it work for us now? Because we take clean zeolite, detoxylite, and it dirties itself again by picking up the pollution that's accumulated throughout our lifetimes in our body, weaponizes that poison against the problems. So now you've got a much, much more ingenious and powerful concept. And interesting about the fast food origin, because what's that tell you? Worked her fingers to the bone. And it was just like when I was at the pharmacy, you were haunted by passing the bags out the window. I know this is bad for you. I know this. Here's a piece of paper. If you're taking a statin, look at CoQ10. We'd hand the paper out the window. We're filling the scripts, and it's, what in her presentation today, there were several gigantic moments. I didn't sell it. I walked away from it because it was hurting people. I didn't want to do that to anybody anymore. Wow. You build a business, has value, slide the window shut one day and say, I'm handing no more bags through this window. Now it's crunch time for pandemics, and she decides to reinvent herself and learn how to see what others cannot see. Really, really interesting to me that the differences are not grand. Maybe some people, maybe somebody like Marcy could run their hand over a person's body and find those places. But that doesn't create an image. It doesn't transfer to the other's mind, other person's mind nearly as well. To create an image, have a trained thermologist. And I thought it was really a big deal to me. She's saying, okay, a thermologist is a specialty. So what's going on, in the medical world now? People take on specialties. That's fine. So what's your interaction with all the other specialties? It should be supportive of their expertise, correct? So you come across somebody that's a thermologist, and all of a sudden, whatever you are in the world of thermologist, you're an IDK doctor. What do I mean by an IDK doctor? I don't know. Go ahead and admit it. We're not going to think you're a flippin' idiot on your topic just because, you gave an auto. When you give an auto no, though, we begin to be suspicious about your motives. Do I look like a Porsche payment to you? What do I look like? You don't want to send a Porsche payment out the door, right? We're going to have to do our image too. Guess what? If you do their image and you go to a different institution, a different hospital, they will have to redo the exact same test. Why? Porsche payment. Same exact image. That's brutal, but I've seen that. Every time the patient gets moved to another one, they have to re-image. And there's danger in imaging unless it's done like this. That auto no. Please, and this is what I hear in Kelly's voice. You can pick up the stature, right? When she started speaking, when she started answering questions, interacting with you guys, she is absolutely confident of which she's speaking. Every other practitioner in her clinic joined her. Her daughter became what she is because they outsmarted the daughter's problem using a chiropractor. You know, those kind of things. And I don't know if you say this in a position like Kelly's, but I'm going to think it. And I have said this, you know, how confident are you in your no? I'm absolutely positive what I'm telling you is a yes. That's correct. I am absolutely positive. How confident are you in your no? How much background have you got behind your no? How much background have you got behind your canned answer? I'm kind of probably need to apologize. You probably can tell she hit a little nerve there. Sorry about it. She found a spot that was a bit touchy there. And anyway, I did find it fascinating that pre-imaging neutralization of your temperature. Don't be monkeying with it and then come to me because I will see those differences. We want to see the differences caused by, it's not that I won't see differences, but we want to highlight. So instead of giving a contrasting dye, something like gadolinium to go with an MRI, something like that, I'm just asking you to please take some time, allow your temperature to remove, you know, return, hopefully not all the way to room temperature. That's a different problem. But let your temperature settle, and then I can see what I want to see with and I got to tell you, second time today, this and you know, Kelly and I have gotten to do a lot of three-way calls, and it's, you know, neat with Vernon. We're going to talk a couple things with Vernon when we talk, you know, getting blood to be able to pass through the capillary beds. That's probably part of the issue. So we want to clean that all up. Allowing the nerves to have the insulation on them, that means you need to pee mercury for quite a while so that the insulation could be remade on the nerves. You know, those are the two biggest things I hear with Vernon Sims in his talk. But when in her presentation, she said, all of a sudden, instead of an imager only, maybe you and I can put our heads together and get a difference. So here's the structure of the call. What's the situation? Okay, you know, where are we? Tell me what we're up against. That, and like she says, if you're half naked, you have intimate conversations, and she's easy to talk to. I'll tell you what, when she sets out to be quiet, she can be real quiet. And she has an amazing skill that way. She'll get to talking. She's got me going right now. But it was because she came in with power. And that's what I want to talk about. If you're got a problem, okay, what's the most powerful thing you've found so far? In her clinic now, she said it bluntly, the most powerful tool I have is Avini to back up the thermography. The most powerful tool. I think that's probably plenty for me. I don't want to start the clock all over. I probably just did. I apologize, Christine, but
Thank you, Chip.
didn't want to let that crock run too fast. Whoa, Chip.
Great.
Oh, boy.
Thank you, Chip. We appreciate you always being here. Kelly, I'd like you to join us again. We have a couple more minutes. We're running into the hour. So if you would leave our listeners with some wisdom and something you'd like to share.
Christine, can I ask something first? Because we heard Shu's name throughout this whole thing, that this guy came in. And I think for those of us that are trying to, for those of us that are introducing Avini to our areas, to know that it's not some young person, but it's somebody like all of us on this Zoom call.
Well, I'll tell you what I'm going to do, Hannah. In light of time, I'm going to have Shu on next week with us, okay? I'm going to have a special guest next week, and we've had Shu on. So, Carol, if you want to show Shu's picture real quick, please do, and then we'll give Kelly the opportunity, because most of us know Shu, but if the guests don't. So, put Shu in that picture there for a moment, and Shu will give us a thumbs up. But I think he deserves his own call because he is an amazing man. Very inspirational. There he is. Let's give Shu some love. Thank you, Shu. Yeah, we've had Shu on before, and we're going to have you on again. So anyway, thank you, Hannah. Kelly, if you don't mind,
Yeah, absolutely. So just words of wisdom, huh?
Yeah.
I've got to say, I am absolutely blessed. My business for Avini grew very quickly, and it was three-way calls, period. And you don't have to, I mean, I can tell you too, you don't have to know everything because I knew nothing. All I knew was I had something that might help you. That's all I knew. And that's what I told people. I would hear, you can't believe some of the things I hear from people who sit in my chair. Absolutely crazy things. But there is not one person who sits in my chair who doesn't need a Avini. Every single person needs it. And so Chip says I'm quiet. Well, I think that's a gift because in that quiet I can hear and I can listen. And that person's going to tell me something that makes my ears perk up and I'm like, "Hey," and I take notes. So I don't forget to talk to them, when we're done with whatever the imaging or whatever we're doing, I take notes or I'll tell them, "I've got something I think is going to help you. Let's get through this and then let's talk about it." And so don't be afraid to open your mouth. I guess that's the biggest thing. Don't be afraid to open your mouth, even if you don't know everything. There are people who do, and they want to help you. I had talked to Robin on the phone one time, and I think Chip again, one time when I started calling them and saying, "Hey, Robin, do you remember me? Shu just recruited me and I'm brand new." And she'd be like, "Oh, yeah, yeah, I know who you are. What you got going on?" And Chip the same way. "Yeah, I know. What do you got going on?" I mean, people want to help you. So
Yes.
if we've got amazing things in our hands, and if we don't tell them, who's going to? So
Thank you,
that's
Kelly. So,
words of
Shu,
wisdom.
you're up in 2 weeks, okay? You're going to be our feature, and he's going to give us some lessons on this. So, next week, we're excited because we have Tony Abeta will be our guest next week. She will be our guest next week on Avini Vibes, and then we have Shu the following week, as long as his schedule is clear. But we always want to, again, share. I read a statistic, and it was from 2024 that an estimated 310,000 720 women will be diagnosed with a type of invasive breast cancer. Terrible, terrible, terrible. That's why we're here, not to make medical claims, not to diagnose, but we're here tonight because we heard from a powerful woman that is doing her best and sharing. And it's all about prevention. And it's all about you going out and telling the world about Cell Defender and Avini. Best company there is. We take the bad things out because we all know a cleaner body can fix itself. So God bless each and every one of you. We'll see you next week. We'll have the recording. Thank you, Carol. Thank you, Chip. Thank you, Shu. And thank you all our listeners tonight. And we'll see you next week. And thank you to our special guests.
Good night.
Kelly,
Thank
Thank
you,
you,
Kelly.
Kelly. Thank you, Kelly.
Thank you.
Good night, all.
Love
Bye.
y'all.
really, really
Bye.
Thank you, Kelly.